Hi, my name's Sammy Kadak, and I'm a pelvic health physiotherapist, and I work particularly with mums through pregnancy and postpartum, and I also fit pessaries to help women with prolapse. So I wanted to talk about the role that pessaries might play during pregnancy if you're experiencing prolapse or postpartum. And I find them to be such a useful tool if it's appropriate for you. Personally, I do have experience with prolapse and prolapse symptoms. I'm currently pregnant with my third. And so I thought I'd share some of the things that I've noticed through my pregnancy journey and what I also see with my patients. So, common symptoms of prolapse include a feeling of heaviness or pressure in the vagina. There can also be some palpable, or you can get a feeling of some squishiness or maybe some bulging into the vagina or just outside of the vagina. For some women, prolapse can also contribute to a bit of urinary retention, so trouble fully emptying your bladder, or with the bowels as well, trouble fully emptying the bowels. And going through pregnancy, we know that there's so many hormonal changes that happen as you progress through your pregnancy. There's also the physical changes and increasing load that is then placed on the pelvis again. So, what a lot of my patients and what I noticed in the initial stages of pregnancy is an increase in all of those symptoms. The uterus is just still sitting so low in the pelvis, but rapidly growing and getting heavier that the pressure is literally just right there in the pelvis. And so things can feel a little heavier. Urinary retention was a big thing for me and for a lot of my patients. But then one nice thing that happens during pregnancy often is that as the uterus grows, it's going to lift up and out of the pelvis, and it's filling your belly more so. So all of that early pressure is actually relieved as you go into more your second trimester, third trimester, with the potential that as you get closer to the end of your pregnancy, baby starts to drop and everything starts to feel a bit heavier again. So to help manage some of those symptoms, a pessary can be a helpful tool. Currently in Calgary, we can't fit you with a new pessary during pregnancy if you haven't had one before. There is the facility of the Pelvic Floor Clinic that you can be referred to, and they will fit and educate about pessaries in pregnancy. If you've already used one before, we can continue your care and make sure that you're managing well and using it well. So what I found, so this is the type of pessary that I use. It's called a ring pessary, and it helps to provide some great support to the front wall, so the bladder, and then the uterus. During pregnancy, you do need to be a bit more diligent with the management of your pessary. So taking it out a bit more often, making sure you're doing your thorough cleaning process. Just by nature of having something in the vagina, the pessary increases the likelihood of having an imbalance of pH, an imbalance of vaginal flora. So a yeast infection, for example, or bacterial vaginosis. Now, both of those things can exist healthily within the vagina, and it's just when there's an overgrowth of one or the other that we can have more of an issue. If that is happening more during pregnancy because of those hormones and everything just tends to be more during pregnancy, we would encourage removing the pessary probably more frequently than you usually would, and also getting regular checks, so maybe once a month, if you're using the pessary throughout your pregnancy, to check in with your doctor and actually have a screen to see, is there any yeast infection, is there any bacterial infection, so that when it so that you're staying on top of it and treating things proactively, and making sure that there's no ongoing infection when it comes time for birth as well, because we don't want anything traveling up the cervix and into the uterus itself. So a pessary can be safe to wear during pregnancy. I would highly recommend consulting your pelvic health physiotherapist or your obstetric care provider. probably an obstetrician would have a bit more knowledge around the pessaries and the safety of using them during pregnancy. Ring pessaries are okay. Dishes are usually okay. Cubes, I would just double check because there is some suction associated with the cubes, and we don't want to risk the mucus plug of the cervix during pregnancy. So do double check with your care provider if you'd like to continue using your pessary. A pessary during pregnancy won't necessarily prevent things from progressing as your pregnancy goes along, but it can be really helpful for relieving the symptoms, keeping you comfortable, keeping it off your mind. Often one of the worst things about prolapse is the worry and the mental toll that it takes when you're feeling that heaviness and pressure all the time. So if we can relieve some of that, help you feel a bit more comfortable, give you that extra confidence as you're doing things, and especially if this is a subsequent pregnancy, there's a good chance you're still looking after another little human and doing a bit more lifting and that kind of thing. So I personally found that I did use mine early through pregnancy, from about week 7 till about week 14. And then I actually felt pretty comfortable without it when I didn't need it. When things were feeling a little more uncomfortable or like pressure in the vagina, turns out it was actually more related to tightness through my pelvic floor. So I was able to get on top of that, do some self-release, saw my pelvic floor physio. And it's been feeling really good ever since. And I'm 36 weeks now, and I'll consider using it if I need to towards the end, but we're pretty close. So that's been helpful. After baby comes, if you have existing prolapse, or if you start to develop this, bulging or feeling of heaviness, there's just so much change that's happening within the first few weeks after having a baby that a lot of symptoms will probably just get better with time. I highly encourage, if you are having those symptoms, to take rest very seriously. Spend some good horizontal time during the first couple of weeks at least. We know that there's a really unique window of time where the connective tissue from pregnancy has gone from really soft and stretchy as it leads up to your birth, letting everything create enough space for baby to come out, to then gradually getting a little stiffer and tighter. So if we can avoid any unnecessary strain and let things heal in a good position, then that can be really helpful for setting you up for things to actually sit in a better position a little further down the track as well. After my second baby, I started using a pessary fairly early on. You do want to make sure that the perineum has healed. For example, if you've had any perineal tearing, we do recommend that bleeding is finished for at least a week, so then we know that the cervix is closed, there's less risk of infection, and we would want it just to make sure that it's comfortable at that time for you. So postpartum, in the clinic, we're able to fit women with pessaries whenever you feel ready, and as long as those conditions are met and the tissues are healed, and it is safe to do so. And then the use of a pessary postpartum, I think of it as being a really proactive tool. If we can support those tissues as your pelvic floor is getting stronger, as that connective tissue is getting a bit stiffer again, then it can set you up for some better outcomes down the track. Some of my mamas will find that they need the pessary as a temporary support, so maybe for the first 6, 12, 18 months, and then they don't really need it after that. Some of my ladies will continue using it for ongoing exercise. So if they do a lot of high impact exercise or a lot of high loads or heavy lifting, that can be a time where they just feel better wearing it, but maybe they don't necessarily need it all the time. And then some of my ladies will continue using it as an ongoing support. So it really just depends on what your individual needs are and what feels comfortable for you. So that's a lot about pessaries. After baby, you can use any of the different styles that are available. We just need to be a little more cautious during pregnancy to make sure that there's no risk to the cervix or that mucus plug. If you have any questions, please feel free to comment below. You can contact me. And yeah, hope that's been helpful. I'll be sharing more education around prolapse and good bladder and bowel habits and safe exercise for prolapse and pregnancy and beyond.